Morning, everybody. It's a pleasure to host today Mr. Marko Korenjak. Marko Korenjak is the current president of ELPA, the European Liver Patient Association, and the president of Slovenia ELPA, the Slovenian Association for Patients Suffering from Hepatitis. Is leading activities of communication and dissemination in the framework of many EU-funded medical research projects. And to be more precise, ELPA is part of 10 EU-funded medical research projects. One of them is, of course, the Liver Screen project. Welcome.
Thank you very much. Thanks for the invitation.
You are always welcome. So just to warm up a bit, I will start with a super general question, because I think that people asking themselves why a patient organization part of a medical scientific project. So my question is, what is the role of patients organizations participating in medical scientific project, and why, from your point of view, this participation is crucial for the patient community?
So thank you very much for the question, and again for the invitation. So a few years ago, European Commission has noted that there's a lot of money going into medical research, and there's a lack of sharing information to the general public about the research that is done and the results of the research. So the European Commission decided to change the rules a little bit and to prefer to include end-of-the-line consumer or patient advocate in the process of the medical research, in order to ensure that the general public will be informed properly about the research that is done, about the results that are on the table, and about how money from European institutions is spent. So we have seen this already in some other field. For example, in the cancer field and the cancer research, the patients were involved even many years ago into the process. They were asked if the process is okay, will they be okay with that kind of a research, will people participate in that research? So we have seen this spread of inclusion of patient advocates and patients, also in the space of liver research. And Liver Screen is one of the projects that is doing right that. So the role of patient advocates in that Liver Screen, it's hugely important in not just informing the general public, but because this is going to be the biggest liver screening project in Europe. And important because of data that is showing that at least 20 to 30% of the general population has problems with the liver, and we can have early detection. With early detection, we can significantly lower the cost of the budget spent on healthcare, people having liver diseases. And this is for the decision makers a great thing to see. But for the patients, it's important to have early detection of any kind of liver disease, because if you are detected early, you have a wide variety of things that you can do. And today we have many patients that are diagnosed with cirrhosis or end stage of something with the liver. And this is a problem, because if they would be diagnosed before, years before, they would have like several things that they could do to improve their health. But now, with the healthcare systems that are in place or things that we are doing, we can see from the data that the majority of people who are diagnosed with, for example, with cirrhosis, are the people who are after 50 years of age. So with the Liver Screen project, we want to screen the general public for the early detection of any kind of liver disease, especially to find people who would be diagnosed very late.
Thank you very much for your answer, and thank you because in your answer, basically you describe the main objective of the project. And browsing the website from outside, so not being involved in the project, the first information that you can read is that the Liver Screen project will screen 30,000 people recruited from many different European countries. It's quite a goal, and it's also quite a number. So specifically, how ELPA contributes to this objective?
So I was very honored to be invited in the project that was one project prior to the Liver Screen Horizon 2020 project. And this was like a pilot project trying to show that if we do early detection of liver diseases in general public, that this is very beneficial for patients, patient communities, and also for the decision makers. And on the ground of that project, it has come to the development of the Horizon 2020 Liver Screen project, which is a bigger project involving several different clinics, research laboratories, and the main principal investigator has invited us to be part of the project from the beginning. The role of ELPA in that project is to be the leader of the working group on dissemination and communication. So I think this was done also on purpose, and we do agree with it because we need to spread the message about the importance of early screening for liver diseases. And in the scope of that project, we have also come to an agreement with the companies that are doing like equipment, medical equipment for research, for finding out, for screening for the liver diseases. We have come to the agreement that the production line could also be changed in a way to have medical equipment that would be more accessible to general public, so that we could scale up the screening process, not just with 30,000 people, which is extremely impressive number today, with the things that are done in the way that are done today, but also in the future that going for a liver screen process would be as easy as going to the store to buy a bread.
Thank you very much. I'm shifting a bit from the scientific field to the political, let's say, because you mentioned the decision makers. I had the opportunity to speak with the head of the work package dedicated to collect all the data from the different countries. And she told me that she was quite struck by the fact that the healthcare systems in the EU have such a difference, in terms of care, in terms of money, money allocated, in terms of many things. And I know that ELPA has also a policy work. One of the area in which ELPA works is also the policy field. Do you think that a project like that, that is mainly scientific, so it wants to screen and to use a non-invasive way to screen as much as people as possible, could also send a message to decision makers in terms of healthcare system in general and difference between them across Europe?
So yes, of course. So the answer is simply yes. So the message of the project is that we can significantly lower the cost of the procedures for liver patients if we do early detection of liver diseases. And I think it's a very good message for decision makers. And in regards of the inequalities in the healthcare systems in European Union, so we believe that if you are born in Portugal, in Germany, or in Romania, you should have some basic things that you can access, like a liver patient. And this is now not in place. So when European Union started, so when it started from different reasons, but when it devolved and evolved, we decided to have like free transfer of people, of products and everything, but we didn't decide on having a general or common healthcare system or healthcare system parts. So I think that for the future, it will be very beneficial to have at least some parts of the healthcare system that would be in the scope of European institutions. So every country is now deciding for itself what to do with the healthcare program. And I think it's good to have the to be able to decide on what to do on a healthcare level, because there are wide differences also in the diseases and patients in different countries. But we should have like at least something that you can expect if you are born in European Union, and that should be the same regardless of where you are. And with that, I should stress the problem of liver cancer. So if you are a patient of liver cancer and you are diagnosed with liver cancer, your life expectancy is getting lower in regards of what is your country doing in the space of liver cancer. So if the country is doing zero or a little things, you can expect to die earlier. And if you are born in a very developed country with the developed healthcare system, like for example, in some big city in Germany, you can expect that you will have access to many kinds of different treatments that will prolong, not just prolong your life, but also to increase the quality of your life. So we think that, of course, we cannot develop all healthcare systems of all countries on the same level, but we should at least agree on some basic things that could be there. And these basic things should be connected to the improvement of the quality of life of the patient and trying to increase the numbers of days, years that the patient will live.
Thank you very much, Mr. Korenjak. It was a pleasure having you today.
Thank you very much.